Once again, thank you very much for joining us. 65 million people around the world live with epilepsy. And 8 out of 10 people with epilepsy in developing nations do not receive appropriate treatment. That's scary, and you're hearing this especially today because it's International Epilepsy Day. This day is marked on every second Monday of February and dedicated to people living with a condition. Started in 2015 and organized by the International Bureau for Epilepsy and the International League Against Epilepsy, this day provides a platform for people with epilepsy to share their experiences and stories with a global audience. Today also calls for all people to press for appropriate legislation that will guarantee human rights of people with epilepsy. This year's theme is putting epilepsy in the picture. Mama V. Owusu-Abuaje has been speaking to Dr. Albert Akpalu. He's the head of Neurology Department at the Kolebu Teaching Hospital and Secretary of the Ghana Epileptic Society.
When you take the entire population, how many people would you say have epilepsy?
Well, our prevalence figures are about 1% of the 1 to 2%. So with our population of 25 million, that should give us about an average of under just about 250,000 people plus, people living with epilepsy.
Okay.
So this year we want to change the term. So we don't say epileptic anymore.
Okay.
So epileptic has stigma connoted to it. It's a derogatory term, so we use persons with epilepsy or persons living with epilepsy.
Okay.
Okay.
All right.
All right.
And I see that you gave us a treat, myself and my entire crew, when we walked in here this morning, because we had to check our blood pressure
and your blood sugar
level.
Okay.
Yes. How serious is that? I mean, what does that mean? Is this something that everybody must do?
Yes, something everybody must do. So non-communicable diseases, of which epilepsy is part of, it's a double burden. We have HIV, malaria, TB, and we have hypertension, diabetes, epilepsy, and cancer. So one of the easiest ways is screening. Each time you come into the hospital for any event, come to visit someone for a clinic, you need to check your blood pressure and your blood sugar. That will help stop lots of strokes, and strokes also lead to epilepsy. So that is where I did the conundrum form. So everyone must have their blood sugars and blood pressure checked anytime they come to a hospital. They must demand it.
Okay. So for everybody watching, what are the basic explanations? What is epilepsy, for instance?
Okay. So epilepsy has been connoted in so many mystical and spiritual forms, but basically epilepsy is a tendency for you to have a seizure. So a seizure is when you lose consciousness, when one part of your body jerks or you fall down. The most people understand is when, if you've seen a seizure before, you fall down and then you start jerking and they foam from their mouth and they urinate or defecate on themselves. That's the extreme. We call that generalized seizures. Then we have the focal, where can be just one hand will be jerking, or a child will be just absent-minded in class, or just some lip smacking, or just one side of your body jerking. That's all. You still you don't lose consciousness. So that's what we call a focal seizure.
Okay.
So those are the two types. So basically, how do people get epilepsy? There are various causes. About a third of the time, you do not know what the cause is. But a third of the time, in our environment, structural lesions. So you have an accident, you're not wearing a helmet, you fall down, you have an accident, you can post-stroke, you can have seizures. The commonest one for us is poor delays in delivery. So the obstetricians and pediatricians, we do a lot of work with them to try and reduce the time for delivery. What am I talking about? Somebody in the north or in the upper part of the body will take 3 days to go into labor because the labor is obstructed. So by the time the baby comes out, the baby is asphyxiated or not enough blood has gone to the baby's brain. So that brain is destroyed. So later on they present as seizures. Also post-malaria, cerebral malaria, post-meningitis, post-head trauma as well can lead to seizures. Sometimes people have a tumor, those are rare. A tumor or a growth in the brain, they can also have epilepsy too as well. Post-alcohol, drugs, cocaine, lots of other reasons. But sometimes it's idiopathic. We do not know, or there are some genetic causes of epilepsy, which we are looking at as well.
Okay, but so sadly we've got a huge treatment gap.
We have a huge treatment gap. So I'll put the treatment gap as 75% of people in this country do not have access to treatment. So that is sad. Why? Because of access to care. A lot of epilepsy is concentrated in areas which are hard to reach.
Okay.
People cannot afford treatment. There are not enough trained personnel. So I'll take for example, there are only 7 neurologists in the whole country. So
in the whole of Ghana, you're 7?
There were 7 active. So we technically cannot manage all the persons living with epilepsy. So we have the mental health authorities, which are the psychiatrists, who also take part of the burden, but even they are not enough. We've even gone further to train what we call community psychiatric nurses who go into the community. That's one of the big projects we are doing called the Ghana Fight Against Epilepsy Initiative. So this initiative is to help to reduce the treatment gap and reduce the burden of epilepsy in Ghana. So we have 5 regions. We are going to scale all up to reduce the burden by going to the community, picking up the clients, educating them, and offering them treatment. So that is one of the big initiatives that the Ghana Health Service and the Mental Health Authority is doing to reduce the treatment gap.
And we do know that the Mental Health Authority will today hold a program actually on this ceremony today at 12 o'clock, and we'll bring you that later. Moving on, the proliferation of fake drugs is a big challenge not only in Ghana but around the world. Many governments are spending huge sums of money to deal with the menace. But what happens when a product being purported to be fake does not even exist? That is the challenge the Food and Drugs Authority seems to be dealing with. I'm joined in the studio right now by the Chief Regulatory Officer of the FDA, Kofi Essel, to have a conversation on this. Also on some fake energy drinks and the challenge of fake medicines in Ghana. Good morning to you, Mr. Essel. Thank you very much for joining us.
Well, thank you, Beatrice. I'm a Chief Regulatory Officer, not the Chief Regulatory Officer.
We have
chief.
There are a lot of
chief
them. Okay.
It's a position, yeah. That's it.
So let's start off with this news making round that there's this drink called Evolution Fresh, which is said to be poisonous and apparently has been imported into Ghana. And you told me earlier that this report is untrue. Tell us about that.
Well, it's untrue in the sense that there is no such product on our markets in the first place. And anyone who claims he's seen this, you see, it's unfortunate that gradually people are abusing social media. And so people have been taking advantage of that to go on trade wars with the competitors on social media. And so something can even start in Nigeria. Someone just picks it, changes it, and it's out there. Just 3 days ago, this story about this product, this Evolution, now you see 2 pictures of people purported to be dead, now attached to the product, claiming that these are victims of the product. And so if this product is that poisonous, would they have killed only 2 people? And who has died? Can anybody identify any single Ghanaian who has died? Because the story says that the product is in Ghana and it is killing people. Where? Where was it reported? Who killed, or what killed these people? Who died as a result of drinking this product? The product is not in the country in the first place. And we've not seen this at the FDA in the first place. And it is not on our market. And I'm throwing a challenge out there. Anyone who claims he's seen this should bring it to us.
But
let us have a look at it.
What investigations has the FDA done to
you do your normal post-market surveillance, which is a routine thing that you do all the time, not because of this product. Okay? And it's always a challenge to us when people are beginning to use social media. Not quite long ago, there was also another story on Jack and Jill. This wafer has been around for God knows how many years. And someone claims that it was exported to or imported into Nigeria. It's killed 20 people there. And the stories always seem to run along that line. Imported into Nigeria, killed 20 people, customs says. When things of this nature happen, it is not the responsibility of customs. The death will have occurred in hospitals. It's the Ministry of Health that will come up, and 20 people dying as a result of consumption of a product, it will be headline news. And so when these things are happening, and I want us, those of us in the media, we want to plead with you. It is not these things. And abuse of the social media platform is going to create serious problems.
So
serious security issues for all of us.
You're saying that this is the challenge FDA has to deal with.
Not only a challenge to the FDA.
People faking fake products, as it were.
It should be a challenge facing all of us, the world over. I get my point. I mean, quite recently, you see people saying that Donald Trump has what? Given free visas to Ghanaians on the social media. It also went viral. Can that be true? Okay, so issues on social media. If someone claims he has found any product that is fake, that is poisonous that has killed people, the right place to report such matters will be at the FDA, or even go to the nearest police station and report it. The FDA will investigate. Social media stories, and I want to use this platform to tell people, do not unnecessarily throw things out there on social media because of abuse of social media. When you are even telling the truth, seriously, people will not take them seriously again. And so it is no good trying to use social media to try and do these things, because unfortunately, like I said, we also have people doing trade wars on social media, attacking their competitors, one competitor or the other. And it doesn't work out well for all
based on the way you're talking, it seems that FDA has had to deal with a lot of these issues coming up. How many, for instance, of products have come to the attention of FDA because people send social media messages around that, these products are dangerous, and the FDA
we heard of the Dew water. You recall Dew water that was exported from Tanzania to Nigeria, and it's in Ghana, and people keep adding on. Okay, and some of the stories are not, there's even some truism in the stories, the way it is twisted, makes it very difficult for anyone to follow. Okay, and it becomes a wild goose chase. Where do you start from? So when you say this product is already in Ghana, Ghana where? The fellow who is reporting that he's found this and he has saved your life and he wants you to save other people's life. Come on, we are becoming gullible to these funny stories. And it is not, it's no good.
How much does it cost the FDA in trying to investigate these claims and these reports?
No, it costs you a lot of human resource, because the country over, you have regional offices all over the country, and officers will have to be thrown out there to go and find out truly if these products are in circulation. So what it means is that other activities will have to come to a halt. So they concentrate your effort as far as human resources is concerned, other logistics, to be able to carry out this investigation to confirm or otherwise whether these stories that we are hearing. I get my point. People will do us a lot of good if they can tell us or give us precise information. I get my point. Otherwise, we become a wild goose chase. And so far, all the investigations that we have done, all the stories that we have followed up, excuse me to say that, it is nothing but hoax. And it makes it very difficult for us, especially on such products. It came through Nigeria, it's killed 20 people, customs is saying it. And you have other sites where people are also embellishing it with other things. And believe you me, Beatrice, today you can sit on a computer, build stories, and then throw it out there.
I'll come to you shortly on how you're dealing with this whole thing, but have you been able to quantify how much financially the FDA is losing in terms of spending?
Well, that is difficult for me to mention at this moment. But like I said, obviously, if, for instance, you have other inspections to carry out, you have other activities to carry out beyond the inspections, and then you have to throw men and logistics out there to go into the markets and then get a report on it, and it's all border on, on our resources.
How are you dealing with this challenge?
Well, using what do you call it, platforms such as yours will help us. And like I said, it's like we're crying wolf. And when there is a real wolf, we'll be found wanting. Because when it continues, and probably we want to call on our communication authorities, the National Communication Authority, for instance, if there is a way that when these things come up and they get that information, they can check up with us. If it is not true, then they can quickly do everything possible to block it. It is possible it can be blocked. I mean, I'm not an IT person, but I believe very well that these things can be blocked so that we do not give room unnecessarily to people to abuse this beautiful thing that we have. It's a good technology. that can be used actually to disseminate very vital, very important, very true information. If we do not control it, then we give room to these unscrupulous persons, and they can do all sort of things to us. They can, sensationalism. They believe, Ghanaians believe in that. I get to my point. And like I said, we're becoming very, we are allowing ourselves for these people to take advantage of us. And so it is a plea to all of us. Do not allow yourself to be abused because you have access to this sort of thing. If you receive anything of that sort, you can call the FDA, and I can mention an MTN number, which is always accessible.
We'll do that later, but let's move on to recent discussion on some energy drinks. I know that the FDA issued some warnings on some energy drinks. Why did the FDA do that?
Well, for instance, as part of our investigations, okay, so things that people throw out there, I mentioned that we equally investigate. And so this particular one, it was also done by somebody, a consumer, who wanted to know what was going on and all that. FDA is investigating it, and so I think I will leave it there, that that information that was passed on was, a genuine one. And like I said, with all other information that you receive, you investigate, okay? And so when you investigate and there is the need for you to take action, immediately you will take action. But as far as these ones are concerned, the Jack and Jill story, there is another one probably at another time we'll talk about, where people make it look like every can Coke that you find out there contains or will contain the dry urine of rats, and immediately you drink it, you are getting sick and all that. It is how truth and falsehood mixed together. It makes everything very difficult for anyone to buy in. But then, with this particular energy drink issue, like I said, the issue is being investigated. The importer of that product, which is registered by the FDA, fortunately, it is not a third party who did what is claimed was done, but he has given indication to the effect that he is responsible for it. I think he's issued some indications, some information to the public, but the FDA investigation is still out there. And what we've directed him to do by recalling the product is being carried out and is being monitored. And so the investigation, it's ongoing.
Hold on, Mr. Eso, we'll come back very shortly with our discussion, to-hour discussion. But at the center of this whole issue is the problem of counterfeit drugs. Many have died. And in 2011, Ghana was ranked number 2 in terms of counterfeit drugs in Africa. Here's a report by Ablan D'Souza.
In Ghana, access to medicine is easy. On the open markets, the streets, and even in commercial vehicles, vending of fake drugs is a crime that is spreading across the globe. While on one hand it is causing health failure, it is also an economic harm, since one ends up paying for the same drug twice or more under the guise of, if symptoms persist, consult your doctor. But many people buy them anyway without care. Sometimes they do not even check manufacturing and expiry dates. We sampled some drugs on the market for analysis. The results were shocking.
The original Rough Rider condoms comes with a silvery lining here with the word "started" embossed. And the fake one, there is no silvery lining. The picture quality is blurred compared to the original Rough Rider condom. On the side of the fake one, you see a NAFDAC registration number written on the side. This is the fake Rough Rider condom, and this is the one with the silvery lining is the original Rough Rider. A layperson, when you buy a Vermos, look for what we call the manufacturing information. That's the batch number, manufacturing date, and expiry date. On the original, the information is embossed, but on the fake one, it's an overprint, just printed on the pack. And then when you turn the other side, you realize that the fake one comes with a NAFDAC registration number. NAFDAC registration number, and then we have JC 2007. But on the original, all you find is JC 2007.
So you have these two here. The suspension is the original from the company. Then you can see this one is using syrup. Then when you come even down here, I don't know if you can focus on it well, you see the spelling of the amoxicillin, the original is with I, and this one is with Y. Then even the arrangement, one uses potassium clavulanate, the other one says clavulanate potassium.
The only difference comes with the information that is on the package. Whilst the original comes with just the batch number, the manufacturing and the expiry date. The fake one comes with a NAFDAC registration number, in addition to the batch number, the manufacturing number, and the expiry date.
The World Health Organization, in its Africa malaria study in 2003, indicated that an estimated 200,000 deaths per annum would be preventable if drugs used were not fake. According to its research, the quality of anti-malarial is steady in selected African countries. Up to half of the anti-malarial drugs in some areas were substandard, and therefore up to half the 400,000 preventable deaths were due to substandard products. Many have become victims to counterfeited drugs. In fact, there are some drugs on the Ghanaian market which cannot be described as orthodox or herbal. Fortunately for these fake drug peddlers, and unfortunately for majority of the populace, ignorance and illiteracy abounds, a situation which results in worsening conditions of patients.
You get FPAC, quick action, Rapino, APC, and so many, Procode, and so many. The malaria tablet like ECT also and rest.
What about
blood tonic. We get something like folic cap, group power, something like liver oil capsules, and some Soluton, Spavita, and Bico and multivitamin tablet.
So when somebody is buying, how do you know the dosage?
The dosage, I know all written on the package of the box. And I know everything inside. And okay, if you, I know, I mean, I know before I sell. I mean, I'm learning before I come outside to sell it. And
how do you store it? Like at night when you are, like there are no people to sell to, and you have to take it.
Okay, you get the something like dosage, the rating on top. Either you buy, so I will take 1 morning, afternoon, or evening. Some be 2 mornings, some be 1 dosage a day.
Where do you keep it before the following morning?
I guess some place where they keep them. I guess boss, chop boss. If I'm crossing, meantime I'll get place where I will keep them tomorrow.
Naka amoda akwe yehi naka kwa komele bi ke komegbeke shinye ni wa dani nko wo ni nko se ma fit mo 2 hours time ni naka.
After taking the medicine, I felt very dizzy. I could not control the bad feeling. So my children asked me to eat a lot. After that remedy didn't work, I went to the hospital for treatment.
David. I get 20 me magbo. I
am told some people have died through this.
No, I'm a year jack, me come near Kami, she may come and wake me, yea. War cordon, cometo and concordon.
She's not alone. Many have become victims. It is even more serious in rural communities. Here, many people depend heavily on drug peddlers due to the unavailability of healthcare facilities. According to the FDA, a 2008 research conducted in 6 African countries, including Ghana, showed 35% of anti-malarial to be substandard. WHO research shows Ghana records an average of 3 million malarial cases yearly and about 3,859 deaths recorded annually. Also, 1,500 children.
So Abladi Souza filed that report, but we know that this piece was put together some time ago when we had issues with fake anti-malarials. I still have Mr. Kofiesa with the FDA with me in the studio. I want to ask, what is the situation now?
Well, obviously, studies of this nature will prompt or will make you review your regulatory framework. You have to implement more drastic or robust systems to ensure that if there are still loopholes in the operations, these will be blocked. And if you have to improve on your testing methods and all that. I recall immediately after this study by the WHO, we had a privilege of improving on our laboratory testing methods and our laboratory testing capacities and facilities across the country, to the extent that every regional office put together a mini lab. We have a central lab in Accra, which is a referral laboratory, so to speak, and a reference lab for the WHO. It's South Africa. And so it's well resourced and ISO certified. And so we are in a better position to do these tests. Picking up a fake medicine requires a lot of sophistication as far as you, the officer on the field, it's concerned. You need to know the security features on the original one before you can actually tell which the fake one looks like. I mean, if you take, I recall some time back, I'll handle a lot of these things in the food sector. You know, we're running after food additives, condiments such as these Maggi cubes, the seasoning. You know, there was a time the packaging of the fake one looked even better than the original one. And so telling somebody selling these products on the market that this is a fake one, he will laugh at you. There are times that those involved in the retailing of these products are themselves peddlers of the fake ones, okay? Are themselves into the supporting, providing resources even for those who are supplying the fake products. And we've even had situations where wholesalers of the original ones are also involved.
So what I want to know is, how have these robust mechanisms you talk about improved the system?
We need to look at another study again to actually compare the numbers as was reported. But I can tell you that after that exercise, we have done more than we used to do. We've had a lot more officers on the field than we used to have. Okay, what we need to consider, and then we continue doing, is the public education. If you take a look at this young guy who had medicines in this plain polythene, and you see them all over the place. For the month of September right through November, I was heading the 2016. I was heading the office in Tamale, you know, and I led a team to arrest a woman in Bupe. Okay, apparently we started chasing this woman all the way from Wa. Eventually, we got her in Bupe. And when she was arrested, she was confused. She couldn't believe it, that we had a lot of information about her. And it's quite unfortunate that this is the person who is faking analgesic, a painkiller, a very potent one. And she happened to have indications in them to make it look like it is being, produced for the French market. But because it is scarce, it comes in here. What we have observed is that at any given time, a fake product will always sell cheaper than the original one. It's been established. And there's nobody who is faking this product who wants to sell at the same price as the original one. They will always go for the cheaper, the cost. And so who are those helping them? It is the wholesalers, the retailers. Okay? And so we want to appeal. And as part of, we will not let go of you if we get hold of you. And so don't entertain them. They will come and they will tell you, I can give you this medicine, it is cheaper, and that is what you want to go for. It does not work that way. I have been a victim of a fake medicine before, myself, my family, my son, in a hospital, he was given this fake medicine from the pharmacy. And it was fortunate that I had it tested in the lab because it didn't work. And I had, another version to try it on a child, and it worked. So I had this other one tested, and it failed something we call disintegration test. It means the product was administered as suppository, and it was just staying in the child's canal, and it was not dissolving. And I can imagine how many children might have died as a result of that. And so faking of medicines, it's a serious issue for us, and we are not letting down our guards as far as these operations are concerned. We'll continue to, get rid of them. But please, those of us on the markets, when these guys come around with these drugs in a polythene bags, don't patronize them. They are not pharmacists, they are not trained chemical sellers, they are not doctors. They cannot diagnose your condition and give you the appropriate medicine.
Mr. Several final words.
Final diseases will present themselves clinically similarly, and the medications are different. If you are sick, go to the hospital and don't patronize these products.
Thank you very much. Kofi Essel is a Chief Regulatory Officer at the FDA, and he's been sharing some thoughts with us on fake medicines and faking fake products. You're also watching News Desk on Journey. Stay with us. We'll be back very shortly.